Fridays usually are not quite so busy at the state capitol building, but with time running out in the 2024 session, House and Senate lawmakers are working at full speed on some key issues, including Medicaid expansion. My colleagues Byron Brown and Richard Lake are standing by live now on the south steps of the Capitol with the very latest developments. Byron, a busy day.
Melanie, definitely a busy day here at the state capitol. Usually on a Friday by noon, you expect this place to be all clear. It's 6 o'clock now. Things just clearing out. You hear the chimes that were ringing here. But it's been a day where Medicaid expansion was the key topic. Also, education funding, two big issues here at the state capitol, getting lots of attention today. We begin with Medicaid expansion. The Senate tipping their hand today, right, Richard?
Absolutely. It's really been just a week full of updates. You know, on Tuesday, we saw that first public negotiations between the House and Senate conferees on Medicaid expansion. We saw the House offer a compromise. On Thursday, we saw the House get stood up by the Senate, not showing up to that negotiation meeting. And then today we have the Senate compromise. And the Senate compromise, really, the most notable concession was the fact that the Senate met the House with that federal poverty level percentage. They met the House at the full expansion percentage of providing coverage for individuals who make up to 138% of the federal poverty level. The rest of the compromise is very similar to that House compromise made earlier in the week, and Senate conferees seem very confident about their offer to the House.
Our plan is real similar to the first, where we were covering the folks from 0 up to 100%, and so now we've went ahead and extended up to the 138 percentile work requirement. So it's almost everything that was in our first bill is in this one. So the work requirements are there, the exceptions are still in there. We put a little bit stronger language if the bill should be. CMS denies it, then the department shall file a lawsuit along with the assistance of the Attorney General.
We reviewed the financing and listened to the House and to see where we needed to be to reach a compromise. And so we've worked and we've come up with a solution. We think this is a positive solution. I'm hoping it's something that the House finds amenable, and we can make sure that we close the coverage gap in Mississippi and really provide the health care that so many Mississippians need right now.
This is a working poor waiver, if you will. And so I think that makes all the sense in the world, and it's unique to Mississippi. Part of this was getting the financing right, and I think that's what you see in our plan. And in our discussions, the House, accepted the exchange. With that, we're able to accept going up to the 138%.
Now, the House can either accept this compromise, amend it, or decline it.
Yeah, when we talk about education funding, but also on Medicaid expansion, we talk about those issues. I want to talk with Bobby Harrison with Mississippi Today. He gave us more insight on what's going to happen with Medicaid expansion.
Also, there's in the Constitution that says that the legislature's in session, the governor has 5 days to sign or veto a bill. If they're out of session, he has 15 days. So technically, there's a good chance, unless they act quickly, they could be gone by the time the governor gets this bill to sign it or veto it, and everybody expects the governor to veto it. And if he vetoed it when they were out of session, then they couldn't take up the veto until January of 2025. So wouldn't that be a kick in the pants?
We're going to hear much more from Bobby Harrison this week on a Mississippi Insight Sunday morning at 10:30.